and I'm so happy to be here. My little caveat right here is I am representing myself. If you could start the slides, that'd be great. My colleague once said that if you look at your work and progress in the scope of a single day, it feels daunting and impossible. But if you look across the arc of a year, the change can be awesome and breathtaking. Let's go back 10 years. The cost of sequencing a genome was $10 million. 90% of hospitals used paper records, and yes, people loved Crocs. Also at that time, then Senator Obama laid out a plan, a proposal to expand personalized medicine. Francis Collins proposed a national research cohort of 1 million people. Neither materialized at that time. But as we stand at the doorstep of another presidential transition, the vision is being realized. PMI, the Precision Medicine Initiative, has strong backing from Congress, funding new leadership. At the core will be a research cohort, as Francis Collins imagined, of 1 million or more people, an open, accessible platform powered by people, bringing together vast stores of data that are currently in silos. What made this possible today? In short, we have the research ability, we have the data, we have the tools, we have the network. And let's look at the figures. 97% of hospitals are using EHRs. The cost of sequencing the genome has plummeted to $1,000. Over the last 10 years, our conception of what it means to participate in research has also shifted. In the 50s, one was poked and prodded with helmets on in the name of research. These are subjects. What might it look like if we move to a conception of participation, not of being subjects? What might it look like if that participation included true partnership on equal footing between researchers and participants? And in detail, what might it look like if we were bringing the purpose of the research? If we could donate our data freely into the research process, if the design was delightful, if the results came back, and if we decided what got published? Too often today, a participant feels like a means to an end, with the end being the researcher's purpose. What about the purpose we bring? What about our lives? Monica McLemore studies preterm birth, and she is flipping the model. She is starting with the moms and the families and asking them what might have made a difference in your lives and for your family and for families that will come in the future. And what if donating data to research was as easy as connecting an API like it is for ResearchKit that turns our phone into a tool for participation in research? Because data is a resource more valuable than money itself in research. And if we have the ability as participants to flip it from scarcity to abundance, that will be an amazing future. This isn't some vision for the far distant future. Actually, most of the leading EHR vendors have agreed to pilot an API so that people can donate their data into PMI. And yes, President Obama, when it's ready, wants you to Sync for Science. Check out the video. Design. This month I had two very contrasting experiences. This dress malfunctioned, and the designer said, I'm going to change my design, and I'll send you $35. Meanwhile, the phone company said, we are super sorry, our systems don't work, but they suck. Let's not be the phone company, people. 20% of trials end without enough participants. We have an opportunity to redesign the process so it's truly delightful for everybody, and this 20% will go away. In PMI, we're modeling a future where part of the value, as Craig said, is to get your own data back, and that can fuel that same cycle of positive change through use of data, as participants might want to contribute their data for future good. In June, the White House and Medicine X hosted a day-long conversation about this idea. How can participants and researchers partner on equal footing? 9 amazing projects came out of that. Tomorrow at 2:30, we will continue our work together. We invite you to join us. I wish I had a tent in the sky like this, but the tent outside is beautiful. Please join us in the conversation as we hear about those initiatives. You and we together can create this future, and we can't wait to get going. Thank you.